Hello, my name is Emma. I'm gonna be your nurse today. Okay, the first thing I'm gonna do is wash my hands and put on gloves. And I'm doing a general safety survey of the room, making sure that there are no wires on the ground, and that the baby's crib rails are up. And what is your relation to this baby? Okay, she's the mother. Okay, I'm gonna check your wristband now. Do you mind telling me your name and date of birth? Okay, checks out. And what is your baby's name and date of birth? Okay, looks good. All right, today I'm gonna be performing an infant head-to-toe assessment on your baby. First, I'm gonna start with vitals. Since the baby's asleep, it's gonna be the easiest way for me to get the heart rate and the respiratory rate. Now I'm gonna be checking the heart rate for 1 full minute.
It should feel pretty natural going. Like, at least go. Yeah. And then after this, clean up this. You're strong. I was like, hey.
The heart rate was 140. Now I'm gonna listen for respiratory rate for 1 full minute.
Yeah, so this is from
The respiratory rate is 40. Both are normal. Now I'm gonna listen to the baby's lungs.
Yeah, that's fine. It's just vitals, breath.
Okay, everything looks good. And while I was testing for the respiratory rate and the heart rate, I was watching the baby's breathing, and she was breathing normally using her diaphragm. She had short periods of apnea, which is completely normal. She had no nasal flaring, and she has no cyanosis, which is normal. Okay, now I'm gonna take the baby's head circumference.
Ask about movement, flip over. Check the butt. No hemorrhoids, flip back over. Are you in it or in the lungs? In the lungs.
And then don't forget, like, the most basic stuff. Like, you're washing your hands, you're closing your mouth.
Okay, the head circumference is 30.5. Now I'm gonna test the baby's height, measure the baby's height. Instead of doing it like this, I'm going to mark it. First, spread out the legs.
Stomach, is that all right?
Mark it.
Okay. Now let me just wash my hands. some privacy.
Okay.
And we'll check around.
Move the baby.
Now we're all clear here. Now let's just get started now. Can I just get your name and date of birth? Did you have any allergies? No. Okay. Great.
Okay. And the height is
I'm gonna listen.
46 centimeters. All right, now I'm gonna test for the baby's weight. And I'm gonna take off her diaper.
Oh, you're gonna do vitals after the heart?
You're right. I can do that.
Because that's what I was gonna do and I completely forgot about the vitals. Because then I
Okay, the baby weighs 1.75 kilograms, which is normal.
And I would have done the whole thing and had to read the whole thing.
I forgot about the bed, so that's good that you noticed it.
Now that the baby is up, I'm gonna go ahead and look at her butt. Make sure she has no diaper rash. Okay, everything looks good. And then I'm gonna listen to the her lungs posteriorly again, since she's already awake and I didn't want to do it before.
Okay, ready? Go.
Knock, knock. Hi, Mrs. Smith. I'm Austin. I'll be your nurse today. Let me give us some privacy and then we can confirm.
Okay, everything looks good. Now I'm gonna test. First, I'm gonna look at the baby's skin, and I've already done that throughout this whole assessment. And I've seen that the baby has peach colored skin. Her mucous membranes are pink and moist, and she has no rashes anywhere. Okay, now I'm gonna check for the baby's extremities and make sure everything is working well. Okay. Right, everything looks good in the arms, and I'm gonna do the same to the legs. Okay. Everything looks good. Now I'm gonna test for some reflexes. First is the Moro reflex. I'm going to gently lower her head, and her arms and legs should extend like so. Okay, now I'm going to do the Palmer reflex, and I just place my finger inside her hand, and her finger should close around my finger. Okay, and then I'm going to do the same with the feet. Her fingers should, or her toes should close around mine. Okay, now the Babinski, I'm going to stroke the sole, and her feet should spread out, should fan out. Okay, now I have a couple questions for the mom. Can you tell me how many times your baby feeds in a day? Okay, she said 6 times, which is normal. And now how many wet diapers and bowel movements does your baby have? Okay, she said 2 small poops and 5 pees, so 7 diapers per day. And how many hours does your baby sleep per day? Okay, she said 12 hours, which is normal. Now I'm gonna educate her, make sure she knows that the baby should be on her back when she's sleeping, and that there should be nothing in the crib. Okay, I'm gonna put the baby's diaper back on. Okay. Is there anything else I can do for you? Okay, she said no. All right. And the baby, the mom's bed is lowered, and the baby's crib rails are up. Her diaper was just changed, and she's calm, so she's not in any pain. And that's it. Thank you for your time. Let me know if you need anything.